regular doses, like these types or this type of medication, you know, like we have this
like how this is for brain negative.
and used for
Tuberculosis is a myobacterial tuberculosis, bacillus, transmission to the person via droplet, coughing, sneezing. Clients at risk. And they should both have put on their healthcare providers if you're working in that area. When I was in the service, I worked in a TB unit. And we had to get a TB skin test every 3 months to see if we converted it. Not necessarily you caught TB, but it was called converting, so that you have those things now within your body. Symptoms, as you can see up there, this is for your own information. Generally, if a member of the family tests positive and is started on medication, the other family members are tested and started on medication. Because
Yep.
of the fact of the transmission.
So then how come you didn't get it?
Because I have a very good immune system.
You just did it.
I just did it.
Doesn't it have something to do with whether the person
you're
in
the first
contact
attachment,
with
but the rest are
has
there.
active tuberculosis, and then it's just, if not, then it's like encapsulated in your body or something like that?
Correct.
Because you could be just a carrier.
Okay.
Yeah, active tuberculosis, yes.
Mhm.
And where I was working at. I'm not going to go into that. I'm just going into medication. I'm not going into pathophysiology of the disease. You can do that during med surg.
I ain't getting it far. This is it.
Drug combinations, generally with TB, single drug therapy is ineffective. Multi-drug therapy decreases the bacterial resistance to the drug, and the treatment duration is decreased. Most medications you get for TB are for a duration of 6 to 12 months, and they are highly toxic. First line drugs, as we can see up there. I think for those of you who are really concerned, I think the drug on the test is concentrated in this area. These medications are metabolized in the liver, and it causes hepatitis. The treatment regime is split up in 2 parts. We have the first part which lasts for 2 months, and the second part lasts for 4 to 7 months. And then they test to see how effective the medications are working, and then your treatment is catered accordingly. INH is your drug of choice for TB. Inhibits bacterial wall, as you can see. Side effects are the interesting thing with INH is that the side effects and some of the adverse reactions are common versus you may or may not see these. A lot of the side effects you do see because the drug itself is toxic. Drug interaction increase the effective INH if you add these things to it. And it decreases with antacids. Alcohol increases the risk of neuropathy and hepatotoxicity, in the fact that the alcohol itself is damaging these areas of the body, and then you add a medication that's doing the same thing. Now we're having a 1-2 punch effect.
I'm guessing most drugs, if you put it with antacid, it's going to have a side effect on it, right?
Pretty much.
Okay.
Well, most drugs, when you put with antacids, the drug tends to fall out. It attaches to the antacid, the components of the antacid, and they're no longer effective. And so when you talk about decreased absorption, it attaches to the antacid rather than running freely, going into the body and then being able to use it effectively. It attaches, or the antacid degrades itself. Yes, sir.
What about PPIs?
That's a good question. That's a good question, because in some cases it does not. In some cases it does. Depending on medication, and then the antacids are given 3 or 4 times because of the side effects and the cell is not having a full effect, which is getting more than you should. Somewhere protecting the pretty much just explains it. If you see anything that says autotoxicity, renal function, we know that the medication is going to affect that. We know that the physician is going to give the therapeutic a dose. We have to watch the dose to make sure it doesn't get too high or too low and affect us or not conquer the disease itself. That was that. That was pretty simple, huh? Oh, that did. Fungal infection, skin, mucous membranes, mild systemic infections, lung, CNS. We have different kinds of antifungals. Some of you have come across these already. We'll be hitting on these in the next few slides. Amphotericin B is a very good antifungal, but it's a last resort because of side effects that you have using it. Nystatin is used commonly in oral. Some of you understand what monostat is? Amphotericin B treats severe fungal infections, actions that binds fungal cell membranes, causing leakage, route, as you can see, in reaction, side effect, adverse reactions. These are things that you may see, but may not. And we have fungostatic and fungicidal, just like with bacteria. How it's administered, how the duration of the administration. And because of the side effects that we have with this medication, we keep on hand antipyretics, or things to keep the temperature down, and antihistamines, corticosteroids, because of anaphylaxis. This medication can cause a retention of water, and therefore we monitor urine output and monitor weight. Nystatin, oral or topical, see where it does. And administration is squish and swallow, or in some cases squish and spit, depending on what the person And the best administration is squish and swallow, because if you have thrush on your tongue, you probably have thrush down somewhere in the throat as well. You want to get rid of that. Gargle if throat is affected. I don't know, do they have new flavors for that now? And they used to be just like grape. I don't know if they have cherry and mango or anything like that. Will they add it to it? That would make sense. Like Baskin Robbins, they're different flavors.
Resistance to this?
Pardon?
Can you build up resistance to this also?
Generally not, because this is a short-term treatment. You're not using it prophylactically to prevent the fungus, but you use it while the fungus is there. Once the fungus is gone, we're talking about 3 to 5 days, sometimes up to 10 days. That's it's usually not very long.
Even if it's repeated use?
Correct. Even if it's repeated. And then we have diflucan used for candiditis, and histoplasmosis. I had a patient once with histoplasmosis. Where's that come from? It's fungal, but where's it come from?
Cat feces.
Well, cat and bird. Bird.
Correct.
They had a big
Cats
case,
and
they
birds.
tasted that down in Georgia, what, in the 80s? And I forget which city it was. The blackbirds just came down upon that city and attacked it, lived in it, and people were coming down with this issue.
You got birds too?
We talk about pneumocystic chronic, we'll be talking about that when we get into HIV. Pneumocystic chronic pneumonia. Medication, rock oral, and then treat candida. And as you can see. Flags are probably one of the best for GI. They generally give that medication prior to a GI surgery. Not all the time. Generally. Okay. Antivirus, viruses, mode of transmission. You guys know how viruses get around. You know what the signs and symptoms are. You guys have all had viruses. Vaccines that are out there. Success rate. Most viral vaccines have a composition where a person has an allergy, they can't take it. And all this does is promote antibody production where the body is now fortified to be able to fight off the virus. We have them for influenza A, influenza, flu shots generally change once a year, depending on what the CDC decides, what kind of food is coming into the country, and where it's coming from, and then how effective it has been up to that point, the disease that is. Gamma globulin, any any of you in the military that went overseas, they had you bend over and do a shot in the cheek, and that gave you an increased immune system for 30 days. What about after 30 days? You're on your own. And what it's used for, herpes simplex virus. Action, as it says, DNA synthesis, effective against herpes viruses, cytomegalovirus related to herpes, and so forth. Treats herpes simplex 1 and 2, and herpes zoster, which comes from what? Chicken pox.
What's CMV?
Cytomegalovirus.
Okay.
Prophylaxis, as you see it up there. Practice abstinence or use of condoms. Malaria.
It's right here.
Can you name the 2 biggest malaria spots in the United States, past and present?
In Africa?
United States. That's the other United States. Close. Louisiana was one of them, but the other one was? Washington, D.C.
The rain.
Up until the turn of the century, they were the highest malaria because Washington, D.C. was built on a small. That's a theory, and I'm not going to get into that. She had a question about sickle cell. I'm not getting into that. Okay, moving on.
I heard they got a cure for malaria now.
Can I ask her a question?
They just came in from medicine for it. Yeah. Last week.
Pharmaceuticals trying to stop it from coming out.
Prevent malaria, don't get bit by a mosquito.
Yep.
This is interesting. Mosquitoes, yellow fever passed out by mosquitoes. You know how they found that out? Dr. Walter Reed figured it out. You know how he figured it out?
Got bit?
I can never remember the nurse's name. She was 24 years old, and she gave herself up as a guinea pig to be bitten by hundreds of yellow fever mosquitoes to see if she would contract it, and she did. Therefore, they realized it was from the mosquitoes, not from something else, and then they're able to come up with a immunization against that, against yellow fever. But nobody can remember the nurse's name. 24-year-old, something to see, I don't know, 15 or whatever. She died and Walter Reed got the credit. Anyway, moving on. Different antimalarial quinine is the generally the drug of choice, one of the most effective. We do have side effects, but not all of them are apparent. Not all of them have it. Question?
What is eighth cranial nerve involved?
Where's the eighth cranial nerve go?
Face.
Hearing. There you go. It involves hearing. Okay.
I don't know
Helmet.
where she got that question from.
Worms. Tapeworm. There was a weight loss back in the 70s from Mexico, they would take this capsule one time a month, and you would lose up to 30 pounds in a month. And people were taking it, and by golly, they were losing up to 30 pounds a month. Until one of the capsules was sitting on a person's windowsill and melted, and the contents were revealed. They took it over to their nearest drugstore and they looked at it, and it was a tapeworm. They eat a lot, and they grow to be up to 21 feet long. And as long as you don't have two of them, they can't reproduce, so then it gets flushed off after it dies. You don't live for 30 days. Pretty ingenious, huh? We sure are gullible, huh? The medication is usually given 1 to 3 days until the issue is resolved. Resting intervention doesn't cause drowsiness, don't want to be driving. Although some of the drivers around San Antonio, I think they're taking this already. Okay.
Pretty tight.
Let me move into this one, then we'll go on break. Drugs, urinary tract disorders. We've numbered some of them already, haven't we? Usually female clients. And the culprit is E. coli. Okay? And that is because of, not because of poor hygiene, but maybe a number of different things. Just anatomy for one thing. Is the biggest issue. This is all your own information. Some of you guys already know all this. I've never had a UTI, so I couldn't always say. Thank you. I've never been pregnant either. I'm happy for that. I always realize I'm glad I'm a guy when my wife is sitting there and she's trying on 7 different kinds of outfits and she's trying to choose, this one or this one. And all I do is put on a shirt, a pair of pants, and I'm out the door. Thank goodness I'm a guy. This is another reason. Okay. We talked about this medication already. One of them we have talked about is microdantin. I don't know if this comes up here a little bit. If it comes up a little bit. The medication that's broad spectrum. We do have superinfection as one of the side effects. And look at Stephen Johnson, blood dyscrasia. That's an adverse reaction we don't expect to see. So because you give the medication, the adverse reaction is blood dyscrasia, you don't automatically think that's going to happen. But it's a strong possibility. And nursing interventions, as you can see here. Pretty common sense stuff. Increase fluid intake, you consume cranberry juice. Why?
Cleanse.
Acid. Okay, acidic. Yes, sir.
Can it happen on the first dose, or is it something we're going to monitor levels?
Generally, it happens sometime after. We're talking usually with the 4th, 5th, 6th dose meat. A lot of times you'll see the apparent reaction before you see the redness in the hand, the face. It's not interesting.
Do you stop medication as soon as you start seeing indications, or do you have to actually see the?
Yes, ma'am.
Do you stop medication as soon as you start seeing like the bright redness of the hand?
Correct. Contact a physician and treat accordingly. And there's ways to treat that, so we're not going to get into that. But exactly, whenever you have an adverse reaction from any medication, the first rule is always to stop it and then contact the physician. So that you don't have that problem continue on any further. We have medication here, Hiprex for chronic UTIs. Becomes bactericidal when the urine is acidic. And that's where your cranberry juice comes into play. Iridium is used basically for more for your symptoms of UTI versus UTI itself, but it can be used in conjunction, using conjunction with Bactrim or other medication. The biggest thing you have to remind or warn your patients of is that they will have bright red, orange urine. So when they don't think that they're peeing blood. One day I'll tell you a story. We have other medications for the bladder, like we have urocholine, which is used for a hypotonic bladder. That means the muscles are not very strong. In order to evacuate the contents and or hold them in. Increase tone of the depressor muscle. Contraindication that can be caustic to the stomach and if somebody has peptic ulcers, to cause further damage. Ditropan, you've seen on TV with the water pipe ladies walking down the street. Okay. Used for direct action on smooth muscles, relieve spasms, so you don't have that. Because when you have spasms to the bladder, you have leakage. Detrol, again, is very similar in nature. Yeah. Why don't you take a 15-minute break? I think I'm down to the last.